So on a monthly basis, if your PORT-A-CATH is not accessed, every 28 to 30 days it needs to be accessed and flushed with normal saline. Or if your client has an order for IV therapies, then you may need to access and dress the PORT-A-CATH site, which is what I'll show you today. The supplies that you need for PORT-A-CATH are a central line dressing tray, a cap, a Huber needle or a non-coring needle, the appropriate size for your client, saline syringe, alcohol wipes, and hand sanitizer. So if I have an old dressing in place or if I'm doing an access device change, I'll need to remove that. We're not going to demonstrate that today, but I would remove the dressing and then I would de-access the site by removing the needle, and then at that point I will be ready to resume, which I'll show you how we get to that point. First I'm going to prepare the needle. This is a little bit different in home care just because we are typically not provided with sterile normal saline syringes. So assuming that we're not provided with sterile syringes, we have to do it a little bit differently. First thing I'm going to do, just like when we have a cap change, I'm going to open up the cap here, try to keep it sterile inside of the packaging. And I did already wash my hands. I'm going to open up the saline syringe. Connect it to the cap. I'm going to prime the cap. I'm going to set that down carefully. And then with my Huber needle, so this particular one is a 22 gauge 3/4 inch needle for my client, and inside of the packaging you can see here the end of the cap. That's the corner that I want to open. Even if it's not designed to be opened right there, you can do that. So I'm going to peel off this corner here and kind of sneak that cap out. Again, trying my best to keep that sterile inside of the packaging. So I'm going to pull that end of the line out just a little bit. I'm going to remove that cap. I'm going to remove the cap on here. And I'm going to connect these two together carefully. And then I'm going to prime the needle inside of the packaging. Just the end of the needle is right down there. Okay, now I have this ready and I'm going to keep it inside the package until I have my sterile field prepared. So again, I've already washed my hands. I'm going to open up my dressing kit. Being careful not to contaminate the inside of the package. I'm going to remove the mask, one for me and one for my client or for my assistant if needed. I'm going to take out the gloves and set them aside. Now I need to remove my sterile field from the packaging. I'm doing my best not to contaminate the sterile field, so I'm going to touch the shiny side since that side is going to be down. Then I'm going to handle it very carefully by just the outer 1/4 inch or the back side. Place my sterile field. Now I'm going to open up this needle inside of the package there. And I'm going to place that onto the sterile field knowing that my syringe is not sterile, so I want to keep that towards the outside. I'm not going to use that corner of the sterile field for anything else that I need to keep sterile. Now I'm ready to put on my sterile gloves. Picking up the first glove by the cuff. And again, the second glove I put my fingers underneath the cup. This particular kit, once again, comes with a ChloraPrep swab stick. Take a look at the instructions. This swab stick says to scrub for 30 seconds and then allow it to dry for a full 3 minutes. This kit also comes with an iodine ointment, which you would use if your client is sensitive to ChloraPrep. It does need to be left on the skin in order to work, so I will not be using this for my client today. Okay, when I'm ready to begin, I'll crack the swab stick and scrub the area. Need to scrub for 30 seconds using back and forth strokes. You don't need to scrub in a bullseye. The friction is what gets this site prepared. Scrubbing the entire area that the dressing would cover, as well as the insertion site. Again for a full 30 seconds. And then it needs to be allowed to dry for 3 minutes. And again, you want to make sure that you're not fanning the area, you're not using anything else to dry it off, but that you're waiting. For the purposes of our demonstration today, I'm going to just wipe it off, but again, you would not do that with your client. After you've used the ChloraPrep, you may want to use a skin protectant wipe. If you're going to use that, again, the area needs to be allowed to dry, and then you would wipe the area that you're going to cover with the dressing using the skin protectant. And then we're ready to access the site. This particular needle seems to be tied in a knot, so I'm handling it carefully, again, knowing that the syringe is not sterile. Okay, I'm going to bend up these little wings on here. That's to help me hold on to the device. Then I'm going to remove the sheath from the needle. Okay, now that I have this ready, I'm going to use my left hand. I'm right-handed, so I'm going to use my non-dominant hand to palpate the port. I want to know exactly where the port is, and I can feel the perimeter of the port. Again, it is circular inside there, so you want to know exactly where it's at. So using 2 or 3 fingers to stabilize the port, you want to hold on to the port, and then I'm going to put the needle in perpendicular to the port. Right into the center, push until you feel your needle hit the back of the port. I can feel that there. And then I am going to touch the syringe to do a small flush, and then I want to pull back just to check for blood return. Okay, and I do have a blood return there. So I'm going to close the clamp. And I'm going to rotate this needle just a little bit since I put it in. It would be pointing toward the client's face. You want to avoid doing that if possible. And then I'm ready with my dressing. Now remember, I did touch that syringe with my left hand, so I want to be careful that I'm not touching the back side of the dressing with that. I'm going to place the place the dressing over the top, making sure that the insertion site is in the middle. It's a little bit difficult with PORT-A-CATH. The dressing tends to kind of tent up around the PORT-A-CATH, so make sure that you leave enough room for the dressing to adhere to the skin, but not to stretch the surrounding skin. Once I place that dressing on there, I can remove the border. And then I'm ready to finish my flush. So I would open the clamp and push pause with this flush of saline. did get a little bit of air in the line from our mannequin here, so I'm going to stop, close the clamp. And then I can remove my gloves, I can remove my mask from myself and from the client or from my assistant. Then I'm going to tape this end of the line that's left of, here at the edge of the tegaderm, just so that I stabilize the edge of the tegaderm. So I'm going to take one piece of tape, tear it halfway through, and I'm going to put it underneath the dressing onto the edge of the tegaderm. I'm going to take a second piece of tape, again tear it halfway through, then I'm going to put it over the top onto the edge of the tegaderm, like that, just so that the edge of the dressing is stabilized. Okay, then I'll get my pen and I will label with my initials and today's date that the dressing change was completed. And then I'll clean up my area, wash my hands, and document the procedure and the client's tolerance of the procedure. So with deaccessing a PORT-A-CATH, the first thing that you want to do is remove the dressing. Again, it's a little bit different removing dressing from this mannequin than it would be from skin. It's a little more difficult to get this off. And now I'm ready to deaccess. I want to fold up those wings, and I want to stabilize the base of the access device, and then I want to pull straight up until it locks into place and it removes from the skin. This is a protective device once it's locked, and then this can go into your sharps container. At this point, I'd be ready to begin the dressing change kit.